Hi, my name is Christy Rushing, and today I'm here to assist Ms. Janice Seago. We're going to be first conducting a cardiac assessment of her today. And now I am going to locate the internal jugular vein. Okay. Here I'm shining some light. Can I get you to turn your head this way? I'm shining some light here, and I see flickering here at the base of her neck. And what the internal, I'm going to do a test that tests the internal jugular vein pressure. What that does is it gives us an idea of how much pressure the right atrium is under, and it reflects our overall volume status and, like I said, the pressure of the right atrium, because when the right atrium is under a lot of pressure, it can actually back the blood back up into this vein. And so if it's too much, then we know that the right atrium is under a lot of pressure. Okay. You see the point of pulsation right there is flickering. Put the ruler on the sternal angle. And it's going to be a vertical line and then a horizontal line on and it is about approximately 1 centimeter, so that's normal. Now I'm going to palpate the jugular veins right under the jaw, cause it to collapse and fill. They're soft. The pulse is regular. No, they're not cord-like. No sign of arteriosclerosis of any kind. And the pulse is brisk. And now I'm going to listen . See if there's any abnormalities. No evidence of venous hum at this time. Now I'm going to take a look at the carotid arteries. I'm going to use the light. Just says both sides. I don't see any abnormal pulsations. Okay. Now I'm going to fill on. Approximately 62 beats per minute and regular. It is soft and pliable. There's no evidence of thrills or pulsations at this time. And how about the other side? The pulse is approximately the same, and it is regular. There's no evidence of thrills. It is soft and pliable. It's not hard. Okay, now I'm going to. Can I get you to hold your breath for just a second? Okay, the upstroke is brisk. Now I'm going to listen. Okay, you can breathe now. Breathe normally. No evidence or thrills or bruise or turbulence that I can hear. Okay. At this time, I'm going to test the hepatojugular reflex. I've partially inflated this blood pressure cuff, and I'm going to apply some pressure to the patient's abdomen above the liver area. And please try not to bear down or hold your breath at this time, okay? I'm going to put a little bit of pressure. Wait a few seconds and see if the jugular vein increases in size. Greater than 4 centimeters is abnormal, and it looks fine. Don't see a large increase. At this time, I'm going to palpate the apical pulse. It's only about half or less than half of patients you can feel the apical pulse when they're lying on their back, so I went ahead and had her lie on her left side. So the ventricle, I would actually be able to feel the contraction against her chest wall. Just flatten your ankle like that. Okay, mid-clavicular line. 4th or 5th intercostal space. Feel it. There's a soft tapping. And the duration is short. The size is approximately 1 by 2 centimeters. And now I'm going to locate the apex of the heart. This is the point of maximal impulse. It's where you can feel the heart beating the best. And this is because the ventricle is contracting and actually touching the chest wall. And so you locate it just like you locate the apical pulse. Mid-clavicular line. 4th or 5th intercostal space. Sometimes when they're lying on the left side, you have to come over a little further. And I feel it. It is, the rate is regular, it's small, it's tapping, and I'm going to measure from there to the sternum. Get approximately how far it is over, and it is about 6 centimeters. It's about 6 centimeters, and the best way, if you don't feel it initially, you can tell the person the patient breathe in, breathe out, and then hold your breath for me. And that makes it easier to find. At this time, I'm going to palpate the epigastric area. I don't feel any pulsations or masses. At this time, I'm going to have you sit up for me. Okay, I'm going to take a look at your chest wall. Your respirations are even, unlabored. About 18 per minute. I don't see any unusual veins on the chest. I'm going to get you to lean forward for me. Okay. No masses, bulges, or abnormal pulsations of any kind that I see. And I'm going to get you to lie on your left side for me. Just like we did when I was doing your apical pulse. Okay, and I don't see any abnormal veins, bulges, pulsations of any kind at this time. Okay. I'm going to palpate the chest wall this time to see if I hear any abnormal, to see if I feel any abnormal pulsations, thrills, or heaves at this time. on the user thrills. And now I'm going to listen to the heart sounds to see if I hear any abnormal sounds or bruise. I'm going to use the bell of my stethoscope. All heart sounds are normal at this time, and there's no evidence of murmurs. Now it's time to assess the peripheral vascular and lymphatic system. I'm going to inspect her arms and legs at this time. Her skin is appropriate. Her skin color is appropriate for race. It is pink. Her hair is distributed equally bilaterally on upper and lower extremities. Her nail beds are pink on bilateral upper and lower extremities. Her limbs are equally sized bilaterally and appropriate for her body. I don't see any abnormal rashes or veins. There is a slight varicosity right here on her right upper leg and a few bruises that I see, but I don't see any bulging veins of any kind. And at this time, I'm going to palpate all of her pulses bilaterally. At this time, I'm going to palpate her pulses. I'm going to start with the radial pulses. They're brisk and strong bilaterally. They're equal. Move to the brachial pulse. That is brisk and strong, equal bilaterally. Down to the femoral area. Strong, brisk, and it's strong and brisk and equal bilaterally. Okay, I get you to put your knee up. I'm going to feel the popliteal pulse this time. Your breast can equal bilaterally. The posterior tibialis. The breast can equal bilaterally. And the dorsalis pedis. And they too are very brisk and equal bilaterally. At this time, I'm going to assess the capillary refill of her upper and lower extremities. It's less than 3 seconds. Bilaterally. And on the lower extremity, it's less than 30 seconds. Bilaterally. And it's warm to touch. Now I'm going to assess her epitrochlear and inguinal lymph nodes. You should bend your arm like this for me. Does it hurt when I do this? And they're non-tender, mobile, bean-shaped, movable, rubbery. No enlargement or edema nodule on the side. Very small. Does it hurt on this side? Non-tender, movable, bean shaped, rubbery. Should put this on there for me. And now I'm gonna just grab a little water for me. I'm gonna assess your inguinal lymph nodes, the horizontal first. Okay. They're no greater than 1 centimeter. They're movable, metal, rubbery. They hurt. Okay. Also assess the vertical. And same, not tender. Any tenderness on the side? And they're movable. No greater than 1 centimeter. Discreet, non-tender, and rubbery. At this time, I'm going to do an assessment on the patient's abdomen. Alright, at this time I'm going to take a look. I don't see any abnormal pulsations, masses, skin color is normal. There is a vertical scar from a transverse C-section in the past. I believe that's where I came up. Okay, she has a birthmark on her left lower quadrant. Okay, now I'm going to listen for vowel sounds. Vowel sounds are active in all 4 quadrants. I don't hear any bruise of any kind or any turbulence that's abnormal in the abdomen. Okay, now I'm going to feel. I don't feel any masses, bulges, or abnormal pulsations. Is it tender? Do you feel any tenderness when I palpate your stomach? Okay, now I'm going to use a little bit deeper palpation. I don't feel any masses or abnormal pulsations. You feel tenderness when I palpate a little deeper? Okay. Now I'm going to palpate your liver. So it's going to be right in this area, a little deeper. The liver doesn't seem to be enlarged, no masses noted at this time. The spleen is on this side. Okay, can I get you to roll on your right side a little bit so I can feel the spleen a little better? No enlargement noted on this area. Can I get you to roll back to your back? I'm going to place my hand under your back here. I'm going to try to feel your right kidney. Take a deep breath for me. Okay. No masses, abnormalities noted, enlargement at this time. Okay, now I'm going to try to feel your left kidney. Take a deep breath for me. No abnormalities or masses on that side either. Okay. And now we're going to test the coordination of your fine motor skills. I need you to tap both knees with your hands. Lie on your back for me. Okay, now lie on your stomach. Okay. I'm going to have you sit back up in a sitting position. Okay, touch your thumb to each of your fingers. Touch your nose. Okay, and then touch your nose and then my fingers. Touch your nose with your, and then touch my fingers. Tap my hand. And touch your toes to my fingers. There you go. And then touch each foot to your shin. Okay. Now we're going to conduct a Romberg test. I'm going to get you to stand on one foot on each side. Okay. Stand on the other foot. Okay. Hop. Stand and hop on one foot. Okay. Switch sides. Okay. Do that side again. Okay. Just walk. Walk for me. Just regular. Okay. Walk heel to toe. Walk on your toes. Okay. Turn right this way. Walk on just your heels. Squeeze my hands. Okay, they're equal bilaterally. Okay, I'm going to get you to close your eyes for me. And I want you to tell me whether it is soft or painful.
Soft. Painful. Soft. Painful. Soft. Painful. Soft. Soft, painful, soft, soft, painful, soft, painful, soft, painful, soft. Painful, soft, painful. Ow! Stop it! Okay. Painful.
One more area, ma'am.
Ow! Soft, painful.
I'm going to test our cortical sensory function, and we're going to do the 2-point discrimination test. I'm going to have you close your eyes for me and stick out your hands, palm up. I'm going to get you to close your hand and feel this object and identify it. Tell me what it is.
A stick of some sort, maybe a Q-tip? I think so, Q-tip, yes.
Yes, okay. And how about this?
A coin of some type, maybe a quarter?
Yes. Okay, same on the other side.
The coin, a quarter.
Okay.
Q-tip.
Okay. Now I'm going to assess the deep tendon reflexes. Okay, I'm going to start with the biceps. Okay, just relax your hand. Okay. Alright, triceps. This back here, just relax for me. Okay, I'm gonna need you to lean back for me. I'm gonna assess your patellar reflex. Okay, your Achilles. Just relax. Okay. Relax for me. Alright, now I'm gonna assess your plantar reflex.
Ridiculous. I'm sorry.
Okay.
Okay.
And
That's
the
nail art.
coolness is only done if the reflexes are hyperactive. They're not. They're 2+, and that's considered a no. Okay. Okay. Our posture is good. You're sitting upright. Your muscles, there's no hypertrophy. They're symmetrical bilaterally. Can I get you to go from a sitting to standing position for me? Okay, you did that well. I'm going to get you to clench your teeth, open and close your mouth from side to side, move it. Put your chin out and bring it back in. I don't feel any crepitus, no edema noted at this site. Now I'm going to assess the spine. I'm looking at it. There's no evidence of kyphosis, lordosis, or lumps of any kind. It's straight, in line, vertical. No lumps or masses. It is warm to touch. No tenderness noted at the spine area. Okay, I've got a few tests I need you to do to test your range of motion.
Chin to chest, chin to ceiling, ear to shoulder, chin to shoulder, touch toes, hyperextended at waist, bend laterally, rotate trunk.
Good. Okay. I'm going to take a look at your shoulders. They're equally, bilaterally. There's no hypertrophy of any kind. I don't feel any crepitus, no edema present. I'm going to get you to do as I do, okay? I'm going to get you to looks like this. Extend. Other side. Right. Shake this way. And this way. And then get you to put your arms down, and I want to get you to shrug upwards. Is that better? And take a look at your elbows. I don't see any edema, abnormalities that are equal bilaterally. No crepitus noted. And get you to do what I do. Hold your hands like this. Up, down, make fist. And then I'm going to put my hands right here, and I want you to put your bend at the elbows. Okay. I'm going to assess your hands. They are equal bilaterally. They both look the same. They're both warm to touch. No crepitus evident. I'm going to get you to your hands down, up, right, to left, and I'm going to get you to squeeze my hands. Okay, they're both equal and strong bilaterally. Okay. Now I'm going to assess the hips. They're equal bilaterally, no sign of edema. They're warm to touch. Gluteal folds. I'm going to test the range of motion. Bend your knees for me. In, out. Put your knees up to your chest as much as you can. Okay. Out. Straight leg for me. Outward. Inward. Internal. External rotation. And then I'm going to get you to push. I'll do this open first. Out to your chest. Bend your knee again. Okay, and put both knees up for me. Press. Yes. Okay. All right, now equal bilaterally. I'm gonna have you sit down for me for just a second. We're just gonna look at your knees. And they look equal, bilateral. There's no hypertrophy on either side. Not okay. Now I'm going to palpate them. Do you feel any pain? Is that your bad knee that you hurt a long time ago?
Oh, no, this one doesn't feel pain. This is the one where I fell.
Okay. So you got a little knot up here. I can feel that.
Made my hip hurt.
There's no fluid that I can feel on either one, just a little pain in the right knee. Okay, now I'm going to touch your range of motion. I'm going to get you to stand up for me. Squat down. Okay, stand back up for me. Have a seat on the couch. Swing this leg inward. Okay, now swing it outward. Okay, now let's do that on the other side. Swing this one, well, you can go outward and then inward. And they're equal bilaterally. Last thing I'm going to assess is the feet and ankles. Okay. I don't see any hammer toes, any bunions, any bursa of any kind. Okay. There are 10 toes on each foot. They're painted. They're warm to touch. Color is normal for a race. Your Achilles tendon, feel any pain or tenderness here? No abnormalities, no abnormal bumps that I can feel. Let me see you fan your toes out, flex your toes. Okay. And then I want to get you to push on my hands at the same time, like you're pushing toes. Okay, that's good. They're strong and equal bilaterally.